Hello guys, how are you? Today we are talking about the medical gas terminal unit as per HTM. This is as per HTM table 11 page number 15. So the first department as per HTM is accident and emergency. We can see how many outlet, how many numbers we can provide the each room. First we are talking about the resuscitation. Resuscitation we give 2 sets of oxygen, nitrous oxide and 2 MFO and 2 vacuum and 2 AGSS. It's the 2 set with 2 set AVSU. For gas AVSU 2 sets. And for the major treatment and plaster room is 1 O2, N2O, MFO, vacuum and AGSS. And some special additional cases for project reference we give Endenox and SA7. This depends on the project. And the next department is Post-Anesthesia and Recovery. After the resuscitation or major surgery or minor surgery, the patient moved to the PSU. So we need the good care for this patient. So we need as per HTM go to 2 outlet, vacuum 2 and air 2 with the 2 set AVSU. And the last room is treatment and room and cubicles. The normal cubicle means it's 1 room 4 bed or 2 bed like that, the treatment room. As per HTM only oxygen and vacuum single set, but most of the case we give medical air also. It's the requirement of the client or biomedical department doctors like that. It's the project for reference for the medical air. And we can let's talk about the each room and the briefly how we can give the medical gas like that. Okay, let's talk about the resuscitation. For the resuscitation, this is the immediate care for the patient, the life saving. This is the under the emergency department. So when the patient, the trauma patient, or they came the accidentally emergency, so we will immediately go to the resuscitation room. It's like mini operating room. So that's why we need 2 sets of outlet. If the wall outlet or maybe pendant outlet or BHU, normally the resuscitation is BHU or pendant. If the BHU, we give the left side 1 set and the right side another 5 outlet. Like that we provided with 2 AVSU with dual circuit. Later I will show you the drawing. And the next room is plaster or trauma. This is the room for the application, the cast plaster or splint, sometime the minor orthopedic like that. So we require most of the plaster cast room require the surgical air. In some modern hospital we didn't use the surgical air. We have the pneumatic surgical tools, so we don't require the surgical air. If the most of the time we give the surgical also, but the as per HTM only require 5 gas: oxygen, N2O, medical air, vacuum and AGSS. But this is, you see the 1P means what? For the project requirement. But most of the case we give the surgical air, but Endenox we give less, maybe 200 or 100, 0.1% like that. 200 hospital, 1 hospital we give Endenox. It's the very rarely used the Endenox in Plaster Room. Endenox normally used for the labor and delivery for the patient leg. And the another room is under the accident and emergency. Another room is Post-Anesthesia Recovery Unit. It's the PSU. This after the minor surgery for the resuscitation or like the critical patient, we keep under observation the post-anesthesia care unit. So we need, it's the like critical care, so we need the 2-set AVSU with the two set outlet. So most of the PICU we give bedded unit, and rarely we give the wall outlet. Most of them we give the bedded unit with the to keep the medical equipment and the light and rail. So we keep in single compact unit, so we keep the bedded unit. So we need the left side one set O2 medical air vacuum and the right side O2 medical air vacuum for the post anesthesia care unit with dual circuit. You know what the means of 2 sets? The 2 AVSU connected to one AVSU, from one AVSU to one set outlet and another side to another side. So later I will show you the drawing for the post anesthesia care unit. And the last is the treatment room and cubicle, is coming under vital sign and exam rooms and observation room. These are under these rooms. As per HTM only require oxygen and vacuum. This is the vacuum and this is the oxygen. But most of the case for the treatment room we give medical air also as per project requirement, or most of them we give for the treatment room. Other triage or vital and exam observation we give only oxygen and vacuum, but the treatment we give three gas for 2 medical air vacuum. So I hope you understand well. If you have any doubt, let me comment. Okay, thank you. I will show you the one example of accident and emergency. These are the resuscitation room. So this is the nurse station. We give AVSU here, one here and 2 here. Then we go to take to this one left side outlet, one right side outlet, like that. And this is the examination room. We give 2 gas. Observation we give 2 gas. And this is the isolation room. We give 3 gas. And this is the medical gas storeroom. And like, if you need more detail with medical gas pipe drawing, please comment below. And if you have any doubt, please comment below. If you need the more videos and more good videos, and please subscribe and hit the bell icon button.